is Molly, and today I will be demonstrating the use of sickle scalers. So the main purpose of the sickle scalers is to remove mainly just supragingival calculus, slightly subgingival. So it has two cutting edges, so you can use both sides of the instrument. And for the purpose of this video, I'll be using two different types of scalers. So for the posterior teeth, I'll be using the Nevi. It just slightly has a slightly longer bend, so you can reach more posterior. So for the posterior teeth, I'll be using this sickle scaler, and then for anterior teeth, I'll be using the 6-7, so it's a bit more straight. So we'll get the anterior teeth with these ones. But like I said, it has two cutting edges, so I'll make sure to adapt the correct side of the instrument while fulcruming on my ring finger, and I'll be using a modified pen grasp and rocking on my fulcrum finger. So next I'll be getting into the demonstration. Alright, so I'm starting on the buccal surfaces on the upper right quadrant. So starting on the distal of number 1, using the cutting edge on the inner cutting edge. So once I do the distal surface, then I move on to the distal buccal line angle, and then move forward for the straight buccal, and then the mesial half of the tooth. So I'm trying my best to adapt a 70 to 80 degree angulation, and keep the tip 1/3 of the scaler adapted to the tooth at all times in order to avoid lacerating the tissue or cutting something on that I don't want to. So I want to keep that tip 1/3 adapted. So I started with the extra or opposite extraoral fulcrum, and then I've moved to an intraoral fulcrum on the same arch once I kind of got to those premolars. Once it's a little bit easier to fulcrum on the same arch there. So now I'm moving on to the buccal surfaces of the upper right. So same thing here. I want to get my 70 to 80 degree angulation. So I'm rolling into the inner proximal once I get there. That's really important in order to keep the adaptation of the tip 1/3. So for these teeth, I'm using my mirror to look indirectly so that I can see what I'm doing. And similar to the buccal, I'm using an opposite arch fulcrum for the molars, so that I could rock on my fulcrum and use lateral pressure to remove any calculus. I want to use short biting strokes. And for these surfaces, I've changed the side of the instrument I'm working on compared to the buccal, so the V of the instrument is pointed towards the distal of the tooth. That's a good way that I can easily indicate that I'm using the correct side of the instrument. And now I'm fulcruming just a tooth behind the premolar I'm working on and rocking on that fulcrum. Wanna turn interproximally, roll into that contact area. Alright, so now I'm still using the posterior sickle, so the Nevi sickle scaler. So now I'm on the buccal surfaces on the upper left. So starting on the distal of number 16. I'm also going to be using indirect vision for these surfaces, and if this was a real patient, the mirror would help me to retract the lip. So here I am, once again, really important to keep the 70 to 80 degree angulation. That's one of my main focuses, as well as the adaptation, like I mentioned. And in order to do that, you have to, or I'm also focusing on having a steady fulcrum so I can keep control over my strokes. I just want to use lateral pressure once I feel the calculus, and then if this is a patient, and then activate my stroke with lateral pressure. So I'm using the working end with the V of the instrument of the terminal shank pointed towards the distal of the tooth. So that's also something I always want to make sure I'm using the correct end. And once I get to that line angle, I want to roll interproximally. Now I'm on the distal of that premolar, and I'm gonna reinsert at the line angle to keep moving towards the mesial. Alright, so now I'm on the lingual surfaces of the upper left quadrant. I'm still using the posterior instrument. So starting on the distal of number 16 once again. And for these teeth, I'm sitting at more like a 9 o'clock position, and the patient might be turned away from me just a little bit so that I can see with direct vision in this quadrant. So I want to use short biting strokes. So also I can use sound as a cue. So if I hear a good scraping sound, that's what I want. I don't want it to be just gliding over the tooth. I don't want to varnish the calculus or anything like that. So I want to remove it with short biting strokes. So I'm gonna keep continuing on with this quadrant, and I'm turning my instrument, rolling interproximally, rocking on my fulcrum, and keeping my 70 to 80 degree angulation, and try my best. I'll keep that tip 1/3 adapted. And now we're moving to the anterior teeth. So change to my 6-7 Sickle scalar. I'm starting with the surfaces toward me on the buccal. So starting on the midline of the tooth and working my way to the surface closest to me. So I also still want to roll interproximally and keep my 70 to 80 degree angulation. I'm fulcruming about a tooth behind the one that I'm working on. And the 6-7 is a little bit of a thicker instrument. So for these teeth on this type of dent, it's working well just because there's not any super tight contacts. But if it was a real patient, I would just want to keep in mind that I might have to change to a different instrument. But now I am doing the buccal surfaces away from me, or the facial surfaces away from me on these anterior teeth. So I've flipped the side of my instrument so that I'm using the correct working end, and also started on the midline, keeping that tip 1/3 adapted, and rolling interproximally. Just using direct vision for these surfaces, and activating with lateral pressure with my thumb to remove any calculus that I'm feeling. And now I'm moving to the lingual surfaces on the anterior teeth on the maxillary arch. So working surfaces away from me. So I flipped the side of my instrument to be using the correct working end. I'm using indirect vision here. And same thing, want to keep my 70 to 80 degree angulation. Rock on my fulcrum, keep my tip 1/3 of the instrument adapted, rolling in approximately to remove the calculus. So now I'm doing surfaces toward me on the lingual side of the maxillary anterior teeth. So same things as I've been mentioning before. Also with the sickle scalars, mainly just focused on the supragingival calculus. We're not really going under the gums with these instruments, just because of the shape of the instrument. We just have to be careful. So staying supragingivally is ideal, but keeping the tip 1/3 of the instrument adapted to the tooth at all times is going to be very helpful. So now I'm moving to the mandibular arch. So I'm starting on the buccal surfaces on the lower left. So I've moved back to my naviscaler to do the posterior teeth. So as I did with the maxillary teeth, I'm going to start on the distal side of the tooth, roll in approximately, then reinsert my instrument at the line angle, the distal buccal line angle, and then work my way mesially. So I'm fulcruming a couple of teeth away and removing any supragingival calculus with short biting strokes is my goal here. Now I'm moving to the premolars. We're gonna skip number 19, obviously, because there's no tooth there. So with the mirror 2, it's helping me with indirect vision to help me see, as well as retract the lip if this were to be a real patient. So I'm gonna rock on my fulcrum and roll in approximately. And as I've mentioned a lot in this video, the angulation, the 70 to 80 degrees is going to be very important. It is one of my main focuses. So now we're doing the lingual surfaces on the posterior teeth on the lower left. So I've changed the side of my instrument so that the V is pointed towards the distal, and I'm gonna work on the distal side of the tooth and then do the straight lingual and then roll my way in approximately to do the mesial side of the tooth. So that's what we see here. Okay, working our way now on the distal side of number 20. We're gonna reinsert at the distal lingual line angle and then doing the mesial side of the tooth. So I'm gonna use short controlled biting strokes, using lateral pressure to remove any of the calculus. Now moving on to the buccal surfaces on the lower right quadrant. So we're using the working end of the instrument with the V of the instrument pointed towards the distal, and I can kind of hear a sound difference once I move to the mesial side of the tooth, which I think indicates to me that I wasn't quite adapted with the 70 to 80 degrees, or the tip wasn't fully adapted. So especially on the mesial side of these teeth on the lower right quadrant is something that I want to improve, especially looking back on this video. I think the distal sounds okay, but mesial side is definitely an area that could be improved quite a bit. But as I'm moving more towards the anterior teeth, I still want to keep the tip 1/3 adapted and that 78 to 80 degree angulation. So there you get to see on the premolars. I'm rocking on the fulcrum and using lateral pressure with the thumb to activate my stroke. And now I'm moving to the lingual side on the posterior teeth on the lower right. So I flipped the orientation of the instrument so that I'm using the opposite working end compared to the buccal. So I'm starting on the distal and then doing the straight lingual and then the mesial. Same thing on these buccal teeth, same thing on the lingual side of the teeth. I think I can improve my adaptation on the mesial side to be better, to keep that 70 to 80 degree angulation and that tip 1/3 adapted. So I think rolling a little bit more interproximally will also help. But yes, looking back on the video, I think that's an area that I want to keep improving on, keep working on, so I can have a more effective stroke to remove calculus on these teeth. And I think working specifically on these areas, the areas I'm not as good on, is something that I'm also working on to help improve my skills. But I think just practicing and keeping adaptation is going to be important for me. And then on these teeth, I'm going to use the mirror to look indirectly so that I could see what I'm working on. And I'm going to fulcrum about a tooth away now that we're on the premolars. And now I'm moving to the anterior teeth, so I've switched to the 6-7 scaler, the Sickle scaler, to remove supragingival calculus on the anterior teeth on the mandibular. So on these surfaces toward me, fulcrum me about a tooth away, and starting on the midline and then rolling my way interproximally. Sorry you couldn't really see the end of those teeth. But now we're moving on to the surfaces away from me on the facial of these mandibular teeth. So also want to start on the midline of the tooth and then roll my way interproximally, rocking on my fulcrum and activating with lateral pressure to use short biting strokes to remove the calculus. And same thing, keeping the 70 to 80 degree angulation and the tip 1/3 adapted as best I can. And also these teeth have pretty large areas interproximally, so I don't have an issue getting the instrument in those interproximal areas. but if I were to have more of a tighter contact, I would also have to be mindful of that. But now as I move on to the lingual side of the tooth, I'm also gonna use my indirect vision for these areas. So same thing on the facial. I'm going to start in the midline of the tooth and then roll interproximally, and gonna approach from surfaces away and surfaces toward me, so that I can remove calculus from all aspects of the tooth, especially because this is where there's going to be heavier deposits of calculus on the linguals of these lower anterior teeth. So there, just rocking on my fulcrum, and there we go. Alright, so that was me using the Sickle scaler to scale the full mouth. Still working on my angulation and adaptation using that indirect vision. So sorry the video was so long. I appreciate you watching. Next week I'll be getting into the universal curate. So thank you very much and have a good day.